Hi guys, thanks for tuning in. For those of you that haven't watched any of our previous videos, I'm Ray and this is Florence. We're both osteopaths from the Martin Vale Clinic. This is the third video in a series of videos we're putting up. Today's video is on lower back pain. We're going to talk a little bit about pelvic pain and why these conditions occur, and then we're going to give you some simple exercises to do at home to try and alleviate your symptoms. So some of the most common conditions we see in the lower back in clinic is a facet joint irritation and a lumbar disc prolapse. So I'm just going to talk you through facet irritation and why the facet joints can cause pain in the lower back. So if you look at the spine here, we have two joints at each segment of the spine, one either side of the spine, and that's the same all the way up the spine. Each joint is covered in a capsule. This holds fluid in the joint, keeps it moving nice and freely and nice and lubricated. Unfortunately, both the capsule and the joint surface can both cause pain. So if you're suffering more like a dull, achy type of pain, it's worse for prolonged stand-ins, hyperextension, these sort of movements. It potentially is more the joint surface that's causing the pain. If the joint gets more inflamed, then the capsule can actually puff up and swell. Once this happens, the muscles around the area will go tight, and you'll start getting a bit of restriction in the range of movement. You may also have a pain referring elsewhere. So if it's the lower lumbar spine, it's more like the pain's going to be in the buttocks or the posterior leg. If it's higher up at the lower back, it may be down the front of the leg or into the groin. When a capsule inflames like this, the pain can travel down the leg past the knee, and you can give you pins and needles or weakness. However, it is quite uncommon. These symptoms are more likely to be from a disc. Normally when it is a joint inflammation, the pain doesn't go any further than the knee itself. These movements can be provoked as well, with side bending towards the pain itself or extension, as this will close the joint and compress the capsule. So another reason why the facet joints in the lower back can cause pain is something called a meniscoid impingement. And this is where part of the joint capsule gets trapped between the joint surfaces. And as I spoke about earlier on, that joint capsule is the pain sensitive part of the joint, so this is extremely painful. Initially it will feel like a very sharp pinch, almost like an electric shock in the back. And then the muscles over that joint will then go tight, basically trying to stop that joint from moving, because the body knows if it moves that joint, it's going to cause pain. But sometimes these muscles tighten up so much, you can be pulled over to one side, or you can be bent over forwards. And you can be stuck in this position for sometimes just a few days, but sometimes even up to a couple of weeks. It's very common for this sort of injury to occur when you're in a bent over position with a slight twist, and you try and lift something from that position. Very common to say builders and bricklayers, or anyone in that sort of field. So another common cause for lower back pain that we see in clinic is something called a lumbar disc prolapse. So I'm just going to talk you quickly through the anatomy of the disc, hopefully so it makes a little bit more sense in your mind why this pain is happening. So if we get to look at the spine here, these orange markers are basically replicating the disc. These are firmly attached to the vertebral bodies above and below, so the discs don't slip, they're firmly attached. When we get a disc prolapse, what happens is we get a tear in the outer surface of the disc. The jelly type substance inside starts to leak out through that tear. Unfortunately, the most common position for this to happen is at the side and at the back of the disc, as it's one of the weakest parts of the disc. Unfortunately, this is where the nerves exit the spine. So as you can see, this red marker, the disc prolapse might push onto the nerve and give symptoms down the legs. If it's a mild disc prolapse, you're more likely to just get maybe a change of sensation over the skin. As it gets worse, you might get a bit of weakness down the leg, a bit of pins and needles, a bit of numbness, and it might progress into maybe muscle weakness and even muscle wasting. Depending on where this happens in the lower back, it will basically change the position of these symptoms over the leg. So it's quite common for patients to present in clinic with what they think is lower back pain. But once we've done the examination, we realise the pain is actually coming from the back of the pelvis. If we look at the back of the pelvis here, we have two joints, both called SI joints, sacroiliac joints, one on either side. These commonly get inflamed either when the joint's moving too much or not moving enough. So it's quite common with patients that either have hypermobility issues or during pregnancy, once the hormones have been released and the ligaments are getting a little bit more lax, or later on in life, once we start getting maybe a few degenerative changes into the joint, there's potentially a little bit of arthritis and they're restricting the movement and they get inflamed due to that. So as usual, the first thing we do after an injury, doesn't matter if it's a facet irritation or a lumbar disc prolapse or a pelvic injury, the first thing we do is ice the area. So I'm going to use a foldable ice pack like this. I can mould it to the area. Again, we wrap it in a tea towel or cover the area with a t-shirt or a bit of clothing. If we're looking at a facet irritation or a disc prolapse, I'd use the ice pack in a vertical fashion and I'll put it over the lower back to make sure we're covering as much of the lower back as we can, and we're covering a little bit into the pelvis as well. If we've got more of a posterior pelvis pain, and then we really want to put it into more horizontal fashion, so we're covering both SI joints. Again, we're using it onto the area for 15 to 20 minutes. We'll give it at least 15 to 20 minutes off, but you can use it as much as you can throughout the day as long as you're using that pattern. So in the acute stages of a facet irritation or a meniscal impingement, the first thing you really want to do, as well as ice the area, is gently mobilise the area. So we're going to start off with some very gentle mobility exercises, nothing too aggressive, just getting the joints gradually moving, okay? So first of all, when you're laying in this position, we're going to gradually bring one knee at a time up to 90 degrees, and then we're going to meet at the other knee. We don't bring both knees at the same time because you engage the hip flexors, and then it'll start to extend the lower back and cause pain. So I'm just going to get Floss to demonstrate that. So if you're your left knee first, gradually bring that up, hold that with your hands, perfect. We're going to gradually bring the other knee up to 90 degrees and hold up the other hand. So in this position, from this position, she's going to gradually squeeze the knees to her chest, open up the joints in the lower back as you're doing that. And she's going to put a little bit of pulsation into that, just almost so we get a little bit of opening and closing to them joints, obviously depending on your pain levels at this stage. If this is too provocative, obviously ease off and bring your knees back to neutral position where they were. We're going to do this for about 15 seconds, and then she's going to just go into a static position, and again you can just go into a slight bit of rotation side to side, again for about 15 seconds. Again, it's just trying to introduce a little bit of rotation throughout the spine. Once she's done this, she's going to drop both knees again one at a time. She's going to take that back down to a neutral position, relax the arms down, again, just so we don't extend that back. From this position here, she's going to bring her knees up, so her knees and her feet together. She's going to have her hands down by her side for a bit of support. What we're going to do now is just drop the knees side to side, very gently, and again we're going to start with a very small range of movement. We're going to do this for around 30 seconds. As you go through the exercise, we're going to gradually take that stretch further and further. So around about the 30 seconds mark, you want to be getting a good stretch for that lower back. Good. Perfect, good. And normally after about 30 seconds, rest, 30 seconds, and then we'll repeat that again. If this is nice and easy and this is not causing you any pain at all, you can take it to a bit more provocative stretch. And this exercise, what we're going to do is drop one leg straight, keeping the other knee bent. This leg we're going to bring it back up to 90 degrees, but this time we're going to contact it with the opposite hand. So we're going to relax that one down. Opposite hand's going to come on the outside of the knee, and then with that hand she's going to pull that over towards the opposite side. So we should feel a good stretch for the lower back here. We're going to hold that for 5 seconds, and then we're going to repeat that both sides. And normally do this about 10 to 15 times both sides. So this is another mobility exercise for the lower back. It also works on the posterior pelvic joints as well slightly. So we're going to start you in this position. At the start of the exercise, Florence is going to demonstrate where she's going to push her spine up towards the ceiling. So this is what we call flexion. It just opens the joints a little bit. She's going to hold that for about 3 seconds, and then bring it back to neutral. And she's going to repeat that for about 10 to 15 repetitions. In the early stages of the injury, when we bring it down to neutral, we don't want to take it past the neutral stage, because if you extend the back, you're going to bring the joints together, you may irritate the surface of the joint to create a little bit of inflammation and pain. After you've done this for a few days and the lower back starts to loosen up, we can create a little bit of extension as we do this. I'm just going to demonstrate that perfect, but we're not going to hold it there. We're just going to bring it to extension, then back up into flexion. We're just going to hold that, really open up, squeeze them back, the stomach muscles, really open up the hand, relax back down, a little bit of extension. After a good, say, a few days and the lower back's really starting to loosen up, we can start to increase that extension quite a bit. So we bring it right way down, really squeeze the joints, close the ass again, then back up, open, perfect. Good. So back to neutral for me, Florence, and hold that there. So when we're doing this, we want to keep the neck in a neutral position so we don't irritate the neck joints throughout the exercise. At the end stage, we're going to repeat this really, like I said, 10 to 15 repetitions. You can do 30 seconds rest and repeat that again, okay? And I'll do that every day. At the end of the exercise, what we're going to do, Florence is going to sit back onto her heels. She's going to come in a little bit of flexion when she does that. She's reaching her arms right out in front of her, and this is called the child's pose. So we open up the lower back here. Again, it's creating a stretch onto the SI joints here. We're going to hold this for 30 seconds just as it is. After that, what we can do is put a little bit of a stretch basically onto each side, just to increase that stretch. She's going to walk one hand over the opposite hand. What she wants to do now is push her shoulders and the upper back away from them hands. So we're creating a stretch on the opposite side to the hands has gone. Hold it for 15 seconds, then walk the hands over to the other side, reaching the hand over the other one, and again, pushing her shoulders away from them hands, again stretching out the opposite side to the hands that are reaching out, and back to neutral. So the next exercise I'm going to give you is an exercise to work on the glutes and the hamstrings. So we're going to start in this position here, Basically to take a little bit of stress off the hamstrings, we're going to bring the feet a little bit closer to the bum. And Florence is going to basically bring her pelvis off the couch. We're trying to get almost her pelvis level with her knees and her shoulders. So starting off with shoulder width apart. If we're nice and stable in this position, what you can do is walk your feet close together, which makes you a little bit less stable. So then your core has to work a little bit harder to hold you steady. So relax yourself down there, Florence. So normally we'd hold that for 30 seconds, rest for 30 seconds, and repeat again for 30 seconds, okay? To make this a little bit more intense, a little bit more progressive, what we're going to do is come back up to that position, and Florence is now going to go into a marching position, so she's going to lift one leg off the couch at a time, just for a second or so, and back down, and we're going to repeat this 10 times either side. The next way of doing that is basically straighten each leg at a time. So again, back up to that position, we're going to hold one leg out nice and straight, hold it for 5 seconds, repeat the other side, again hold 5 seconds, we're going to repeat this 5 times either side. So the next exercise we're going to do is an exercise concentrating on the glutes. So the glutes are really important in stabilising the SI joints as well as helping out with lower back pain. So first of all, get yourself a resistance band. So we're using an open resistance band like this, and what we've done is wrapped it around the legs, and basically we've tied a knot just behind Florence's knees to create a little bit of resistance. She's using the yellow resistance band, which is the lightest one. I'll do something like the red one, which is a little bit stronger. So we're going to lay in a position like this. It's called the clam position. Like I said, a band around the knees, keeping your feet together, and what we're going to do is just basically lift the top knee. So you can either hold it in that position for 20 seconds, so we get a static resistance, or we can do repetitions of 20. So again, if you just bring it to repetitions, Florence, good, and relax back down. So it depends what you prefer. Good, and relax down. Perfect. So you can either do this one leg at a time laying on your side, or you can do it where you're laying on your back and then you're working both legs at the same time. Obviously it's going to be a little bit easier because you've got double the strength with both legs working. So now we're going to do a quick muscle release exercise. But we're going to use a little spiky ball doing this. You can use a tennis ball or anything you have at home that's similar. So I'm just going to pass it to Florence. What she's going to do is just put that behind her pelvis, so into the fleshy muscle called the glute. Okay, perfect. Once that is in the position, what we're going to do with the leg that the ball's under, we're just going to bring the knee up. Perfect. And then very slow controlled, we're just going to bring that down slightly and repeat that. We're going to repeat that somewhere between 20 and 30 times. Again, we want to have quite a bit of pressure down onto that glute while doing that movement. Good, and relax. Again, you can rest 30 seconds and repeat that, or you can bring it into a circumduction. So when you're doing this time, what you can do is bring the knee up again, we're going to drop it out to the side and just roll it over that ball. And again, we're going to repeat that about 20 times. You can do it 10 times and then reverse the direction if you like. Again, that one is really quite nice to relax that muscle off, and it's quite effective to loosen up the glute. So now I'm going to give you a few stretches. So we're going to start off stretching the glute, then the hamstrings, and then onto the quads. So earlier on, I spoke about strengthening these muscles. It's equally as important to stretch them out as well. So Florence is going to start off by demonstrating the glute stretch. So sitting in the chair, she's going to put one ankle over the opposite knee. She's going to let that knee drop down, and keeping her back straight, she's going to bend forwards over that knee until she feels quite a good stretch. She's going to hold that for 30 seconds and repeat that on the opposite leg. Okay, so now we're going to do the hamstring stretch. So we're going to use the chair at home. You can use the bottom stairs or something like that. So what Florence is going to do, she's going to pop the heel of her foot up onto the chair, keeping her back nice and straight, and she's going to bend forwards to reach towards the toes. Like I said, it's important to keep the back straight. Don't worry if you can't actually reach the toes. We're going to hold that stretch again for 30 seconds and repeat either side. And now we're going to move on to the quad stretch. So here we're going to use the back of the chair. You can use the banisters or anything to give you support. Okay, good. So what Florence is going to do now is bend one knee, try and reach up and hold onto that ankle. We're going to try and use the ankle rather than the foot itself. While we're doing this, we have to keep the back nice and neutral. So tuck in the belly, hold that back nice and flat, because if you do extend the lower back here, you will start to close the joints and irritate the lower back. And again, where we wanted to feel this is on the front of the thigh here. Again, hold for 30 seconds and then repeat them to the other leg. So a few tips if you're suffering lower back pain. The first is to ice the area. So this is really important, especially if you're still in the early stages of the injury. So most of the pain is actually caused by the inflammation. So the quicker we can drop the inflammation, the quicker we can drop the pain. When using the ice pack, again, I use a foldable ice pack so it molds to the area. Always wrap it in a bit of clothing or a tea towel so you don't burn the area. Use it 15-20 minutes over the area, give it at least the same period of time off, and repeat that pattern throughout the day and use it for as long as needed. When we're looking at sleeping positions, lots of patients complain about not being able to find a comfortable sleeping position. I find laying onto your side on the side that's not painful is the most comfortable position, and pop a pillow between your knees as such. It doesn't matter if it's a facet rotation or a disc prolapse. If you lay onto your side in this position and the leg drops down, if it's a disc prolapse, you'll be putting increased tension onto the nerve, irritating the symptoms. If it's a facet rotation, you're going to put a greater strain onto the muscles in the lower back, and again irritating the area. So laying to this position seems to be the best for both conditions. When we're looking at day-to-day life, when you're suffering lower back pain, the best thing you can do is move around little and often. So sitting down for a short period of time, get up, have a walk around, get back, sit back down again, lay on your side, have a little rest, vary your position, but the important thing is not overdoing it. You need to stay active to keep the joints moving and keep the area repairing. So thank you very much for watching our video, guys. Today's exercise will very much concentrate on people suffering with acute or subacute lower back pain. If you're looking just to strengthen your lower back or prevent further injuries from happening, you're probably better off looking for more of a Pilates class. Check onto our website with class of the time, and I believe our instructor is actually putting up videos as well. We've got another video coming later in the week, so please tune in for that. Thank you very much. Stay safe, stay well.